We're really lucky to have Dr. Derek Stowell with us it's afternoon now, officially 12:02 afternoon. But we're really excited to have him here with us today. He's a lecturer for the Department of Kinesiology, Recreation, and Sports Studies here at University of Tennessee. He teaches recreational therapy courses for the department, and he's a certified therapeutic recreation specialist and registered horticulture therapist. And if none of those words mean anything to you, I'm sure that he's going to tell us all about it. And so we're excited to hear more. But Dr. Stoll's research has focused on recreation and gardening as wellness and health interventions. And again, I'm sure he's going to tell us about how that works. And he served on multiple boards and professional committees, helping people to advance recreational therapy and horticulture therapy professions. And so we're really excited. This is a really cool field. I'll leave it up to him whether he says it's still emerging or not, but it's still emerging in my mind, and I think it's really exciting that so many people are getting more interested in this. And so, with that, I'll just let you take it away, Dr. Stoll. Thanks again, and thanks for everybody being here.
All right, thank you. Thank you for letting me speak about this topic. I'll try not to talk too fast to get really excited when I get to talk about the types of things that I'm interested in and share that with folks. But so today we are going to talk about mental health, talk about how recreation is a way to help you improve or maintain your mental health, and try to make some of those connections as we go throughout this presentation today. And then I'll have some time for questions at the end. So, want to kind of just start off. We're going to focus today on discussing mental health and how our lifestyle, a healthy recreation, active lifestyle, can help maintain and improve our mental health in general. So it is National Mental Health Month. I'm going to start off with this in the conversation, and then we'll kind of move to some more happier topics. But we all, you probably hear, you probably know this, you probably read this, we've seen it in the media. In the United States and across the world, mental health is we're in a crisis. And there's a lot of reasons why, there's a lot of factors why, there's a lot of things we can do or we are doing or are not doing. And I think I just want to bring these statistics up because I think it's important to note that and be aware of that. And so these are from the National Alliance on Mental Illness. Some important ones, it's more than 1 in 5 Americans experience some form of mental illness. 1 in 20 experience a serious mental illness. And then, more than 1 in 7 youth between ages 6 and 17 have some kind of mental health disorder. So what that means is if we look at even just who's here today, there are several of us that have probably experienced some form of mental illness over the course of our life. And so it's something that we all are connected to. I think we're doing a better job at raising awareness about that and being able to say, hey, I do have a mental illness and hey, I'm getting treatment and that's okay. And we'll go on and we'll talk a little bit more about kind of some other issues related to that. The other thing I do want to bring up is, the idea of suicide. Suicide is one of those things. They state one person dies by suicide every 11 minutes. That is unacceptable. So one of the things that's important to note is if you know somebody that has thought about suicide, or if you yourself have, it's okay to talk about it. So don't shy away from that. Share, talk to somebody, and don't let that fear or stigma of suicide, of the word, stop us from talking to our friends that have experienced it. I have a good friend that committed suicide a little over a year ago. It's happening again, one every 11 minutes. So in that, when I talk about suicide, talk about mental health, I also always want to refer folks to the National Suicide Crisis Hotline. That number is 988. So if you ever feel like you are in a place where you are thinking about suicide or in crisis, 988. If you can't remember that one, 911. But ultimately, and also reach out to people. So don't hesitate if you feel like you have those kinds of thoughts and tendencies. And people care about you, and there are people and there are resources out there. So moving along, talking about mental health and the crisis, and these are from an Access to Care survey that was 22, so it's a little outdated. But it notes there's a lot of issues. One is the cost related to access to care. Another one is not being able to find a provider that is conveniently located, and not being able to find a provider that offers a visit format that they feel comfortable with. Similarly, people that have received care, it's also noted that appointment times were challenging. Providers, convenient location, a lot of times now, more and more people are moving to online, digital formats of counseling sessions. And that's a challenge too, because that doesn't work for everybody. People don't have the access. People don't have, when we're in crisis, we need to talk to somebody in person. I think that's very helpful. And then also the time to get care. I'm a former foster parent, so have had several foster children in my home over the years. I've worked with other foster families and note that, particularly for youth, psychiatric care, at least in Knoxville, when we were fostering, was at least a year waiting list. That is absolutely unacceptable, and there's a lot of reasons for that. It has a lot to do with there's not enough care providers, and I think those are things that we as a society need to really deal with and reckon with as we move forward. So, again, cost, access, faster care to that care, I think, are some critical things we need to work on. And ultimately, we as a country need to do better. We need to be able to help people find providers when it's needed, not weeks or months or years out. We need to have access to treatment and prevention for folks. And so that's what I'm going to focus on now, and kind of use recreation and what I do and what I teach as a way to talk about treatment and prevention and ways that can help us. And really, it boils down to a few things. The concept of wellness, maintaining our wellness over time has a lot of benefits, including helping us deal when things happen that are challenging. It helps us manage that, deal with that, get resources, and take care of ourselves. So if we don't have a really good level of wellness, it's going to be harder to get the help we need when we need it. And some of those things that we can do to help with our wellness include living an active leisure lifestyle. I'll talk a little about what that really means. Taking part in recreation. And also, one thing I've found and see in the research is this concept of social connections. And we all have probably seen this, read this again out there, that, with especially since 2020 and moving forward, digital worlds, everybody's in the digital world, social media. So we're in some ways more connected, but in reality, we're finding out we're less connected than we ever have been to real people, and that is having a huge impact on our overall health and wellness. So when we're talking about recreation and leisure, I want to kind of offer a few definitions related to that before we go into more detailed discussion. And so ultimately, this kind of broad concept that in our profession we talk about is leisure. And this is a definition from Rossman. And Rossman defines leisure as an experience most likely to occur during freely chosen interactions characterized by a high degree of personal engagement that is motivated by intrinsic satisfaction that is expected to result from that. So again, this is things that we're doing when we're not working, when we're not being paid, when we're not doing things that we have to be doing. It's what we do with our time off. And so one of the things that we see when we have mental health challenges or mental health diagnoses is that we often maybe don't have the best um, leisure plan. We aren't doing things that are helping us. Sometimes that can lead to things like substance use and crime and other things that are not helpful. Those are somewhat freely chosen, right? But are those things really building in this intrinsic satisfaction that helps us with our overall wellness? So when we're talking about leisure, there's couple different types of leisure out there. Again, this is from Rossman. This is a Venn diagram, and what this shows is that there's a lot of interconnection, an overlap between different forms of leisure. As a recreational therapist, we focus a lot on recreation, but honestly, all these pieces of leisure are all things that we can use and utilize in our practice and working with individuals, particularly with mental health issues. And so, again, the overall broader concept is leisure, this freedom of choice, this satisfaction we get from it, and the positive effect that we have when we take part in these kinds of activities. So, recreation, And we'll talk about that definition in just a moment. But things like restoration and social purpose and morality are part of what form the concept of recreation. And then also talk about sports too, because this is part of my department, the kinesiology, recreation, sports studies. But sports is more formalized with physical exertion, specific rules, and competition. And you can see here as you go in the middle, there's a lot of overlap between these two. Good example. I went to the Savannah Bananas. I got tickets to Neyland Stadium this past weekend, so I took my family. We got to experience a sporting event. I wasn't taking part in the event, but I was taking part in recreation and events part of leisure, and so that was really fun to do. So you can see how there can be some overlap. Within recreation, this is kind of the formal definition by Rossman, but it's considered leisure that's engaged for the attainment of personal and social benefits. And I found this definition from the Canada Parks and Rec Association. And I really like this definition because I think it really helps kind of put together what I'll be discussing in the next few slides. But recreation is also it's the experience that results from freely chosen participation in physical, social, intellectual, creative, and spiritual pursuits that enhance an individual and community well-being. And so what's important to think about when we think about recreation is there's an individual component, but there's also a community-wide component related to recreation. And that is one of the things that I see a lot in the research that it just keeps over and over again talking about is the community, the social interaction, the interacting with other people. Next, and I'll just kind of go through this sport again, is interrelated to recreation. It's leisure that involves institutionalized competitive physical activity, includes things like physical exertion, a set of rules, and competition. And so again, in a minute, I'll kind of share some examples of how that and recreation work together and related to mental health as we go. But also in sport, in our department, we have sports psychology. So it's working with athletes, dealing with the psychological aspects of sport and helping them work through those things. So what does recreation really do? And there's a lot of research out there. I'm going to share a few research articles and make some connections in the next as we go throughout this discussion, and then talk about what do we do? What's our next steps, and how does this help us? So this is well documented that recreation offers physical benefits. So it's us getting up and moving and going outside and doing something. Um, there are social aspects with it. So interacting with people. If you think about recreational pursuits, so we talk about sports, or we talk about if we like even something like gardening or something like fishing, there's typically, if you look around, there's some kind of club related to whatever recreational activity is, biking, hiking, mountain climbing. And a lot of times what happens is because you like this type of recreation, because you're engaged in it, you want to go find other people that like it, and you build these social networks around that. You meet friends, you go interact with them, you talk about your experiences, you share tips and tricks. And so there is a huge social element to recreation. And I think that social element, and we can see in the research shows that is one of the things that helps people particularly deal with and improve their mental health by being part of that. And there's mental component, including cognitive enhancement, learning new things, experiencing new things, and just kind of expanding our knowledge of whatever topic or whatever recreational pursuit we're part of. So again, if we look back, this is the leisure, different types of leisure, but if you can see how a lot of these are very interconnected. And I think when we talk about recreation and we talk about health and wellness, we can kind of see how this plays in effect. And so I do want to talk now a little bit about wellness. And so there are a lot of different definitions of wellness. But I think when we're talking about recreation and the impact of wellness, I'm going to use this National Wellness Institute definition where there's 6 elements. There's anywhere from 6 to 12, depending on which model you're looking at. But if we really look at and think about our mental health, and we talk about the interconnection, health and wellness and mental health is really holistic, and our physical health. So a lot of these are interconnected. If there's more research showing that if we have emotional health or mental health challenges, our physical health also is impacted by it, increasing heart disease, and all the things. And that has a lot to do with our physiological body as we have a mental health crisis. There are things physiologic going on inside our body. And so, just like when we have a heightened state of anxiety over time, that can lead to other physical challenges. So, and then with this definition, we look at obviously in recreation. If you think about that, again, we talked about the physical element. It's the getting up and moving. We talk about the social element, interacting with people in recreational settings, interacting with people with similar interests. And then we look at the emotional side too, of the feeling that we get when we're taking part in activities. Um, and then spiritual, we talk about that and we think about it's not necessarily organized religion per se. It can be for some folks, but it's also just this overall sense of a higher purpose of something else out there that's more than just me. And then we have the intellectual. So we're learning about recreation. We're learning rules. We're learning how to do it. We're learning how to access it, how to enhance our skills related to different subjects. And that also kind of has some overlap with occupational, which was typically more of what we do for our job or daily living kind of thing. Some other elements to recreation that come up in the research is this concept of flow. And so you may have heard this before, but this is a theory that basically states as we are involved in something that we're really interested in, we have this feeling of what they call flow. It's just being fully immersed in the activity. If you can think about like if you're an athlete or if you're a runner or if you're doing something and you're competing or you're doing the activity and you kind of forget a sense of time, right? You're fully enjoying what you're doing. You're fully enjoying what's going on around you. You're being engaging with other people. So this idea of flow helps us with motivation. It helps us build optimal performance if we're talking about sports. Um, but it's when we're really focused on the activity that we're taking part in. Good example, and this can happen in work setting. Let's say you have a really good day at work and you're really productive, right? You know things are going well, you feel successful, the day feels like it flies by. Or we take another day where maybe not so productive and it seems like the day drags on. And so that can happen in multiple places. Bayram in this article here looked at recreational flow and well-being related to recreational sports. And what they noted in there is this idea, it takes the idea of flow and turn it and uses recreational concepts of how it builds well-being, including increased life satisfaction, improved interactions with our families, improved positive feelings, and also increase in motivation to participate in those sports or those recreational experiences. Another concept in that's mentioned a lot in recreational programming and mental health is this idea of meaning in life. And this concept comes from is attributed to Viktor Frankl, and in his book Man's Search for Meaning. But he stated that meaning of life is desirable things that people want but are not quite sure what that is. But it really, if we look on the right here, we see these concepts of a sense of purpose, connecting to our values, feeling of self-worth. And I think an example of this is when I work with residents of assisted living or dementia or memory care facilities. We'll go into those facilities at times, and we do garden programming. So we go out and we garden. We teach them about growing plants, harvesting plants and vegetables. One of the things that we see a lot is you walk in and some of these residents are just sitting watching TV, which is a type of leisure. It's a really passive form of leisure. It's more of a consumption instead of doing something. But what we see is when we get those residents and get them outside and get them gardening and getting their hands in the soil and planting, caring for plants. One of the things that we hear a lot from those residents and the staff of those facilities was that we gave them something that made them feel like they had worth and value, made them feel like they had a purpose, taking care of these plants instead of just sitting and watching something. And so meaning of life happens and comes out a lot in our recreation because we see the value of what we're doing and we connect that to our self-worth. Now, we're going to talk a little bit now about recreational sport. And so, like that's why I kind of set up the definitions between recreation and sport. And this article by Vela et al. Talks about a systems theory that they came up with or recommended related to mental health. And some important information related to recreation and sport is it was noted in this article that organized sport is one of the most popular forms of leisure activities in the world. And they also noted half of all children and adolescents participate in organized sport in most developed countries around the world. So huge amount of participation in recreational sports activities. This model looks at how mental health is a key component to that. And they talk about the purpose, and it's not just simply winning, but there's kind of two purposes. The first one they noted was provision and delivery of sport programs for fun and enjoyment, and the second one was to protect and promote the mental health of individuals within that system. And so this model talks about it's not just simply the sport, but it's other things related to that. And I think we can see this in sports in general. We see just the other day, I had a colleague on social media mentioning about a sport program and saying this is awful. You know, it's like how parents, particularly we see parents that are really competitive and interacting with their kids and their sports teams. There's a lot of really negativity around that at times. You know, parents like my kid's the best and they need to be the starter, and you know, there's conflict, all that happens. And so one of the examples I think you see a lot and is, you know, this there's a group called the Positive Coaching Alliance. Peyton Manning is part of that, where it's about helping people learn that it's sports, but it's also there's other purposes like they mentioned here. And we need to focus on that and think about that when we're particularly working with younger individuals. A good example that I noticed or recognized or saw related to this recreational sport was at the last Olympics. I love watching the Olympics. I'll never be an Olympic athlete, far from it, but I love seeing the people compete and seeing their journey from training to get to those events. And in February, the Winter Olympics this year, there was a news article about the Norway Olympic skiing. And one of Norway is like the top winter sports, winter Olympic countries of the world. They actually have more medals than any other country in history related to Winter Olympics. And this article looked at and started asking the question, why? What causes that? And they talked about the culture around their society in Norway. One, they have the perfect weather for it, but two, it's the culture. And what they said is it's about raising kids to be happy and confident and to have fun. So it's not always focused on the competition aspect of it, but really about having fun. And from an early age, they get kids basically right as they start walking and get them on skis and getting them out there. And it's about having fun as a family. And obviously over time, as those individuals gain skills and begin showing promise, they invest in them in different ways to where they become more competition focused. But ultimately, their focus is not the competition, but focused on kids and having fun. And I think with this mental health, we're looking at mental health in sports. This is one of the things that we see in the research showing that there's a value in that, and it really has a great impact over time, and also helps build a full active leisure lifestyle that we want to have as a society. So we're all out there doing some kind of recreation, some kind of sport, some kind of thing to help with our overall mental and physical health. So there's several studies out there that I looked at that I'm going to share today talking about recreation and how that connects to mental illness. And then I'll finish up talking about recreational therapy in detail, kind of what that is and why it's a thing. And so this one article by Litweller and et al. Looked at recreation and mental illness. One of the things they noted in this particular study, and they looked at people that had mental illness, benefits of recreation, and recovery. They noted that all types of recreation has been shown to improve improve outcomes for people with mental illness. So that includes physical recreation activities, creative pursuits like art and gardening and music, and also social recreation activities. So it's not just simply the physical activity, but it's recreation as a whole. They also noted one of the important goals of a lot of these programs and these interventions talks about the social inclusion. And so the social interaction and that social component, like I mentioned before, is key, a really important part of how recreation can be beneficial for everybody. This article also goes in and looked at barriers. So what were some main barriers? They were looking at several other studies. And they noted that physical fatigue is one of those. And so, somebody that has a mental health condition might be more easily physically fatigued. If they have other health conditions on top of that, again, we get worn out easy. If someone's depressed, oftentimes, you see in major depression, they might act like they may not want to be physically active, right? And so they get tired quicker. Anxiety, again, that mental health challenge is, being anxious about the experience and not wanting to go out and do it because, what if this happened or what if that happened? Cost is one of the benefit barriers that we mentioned. The lack of motivation. Some other ones, lack of friends to go with. So again, that social element is an important piece of those are things that we can try to help break down those barriers. And then obviously the stigma of mental health and how that impacts of why would I don't want to go out and be part of this recreational activity or because, what if I have an issue or what if someone makes fun of me or what if something else happens to me? They also noted in this study of some successes. And so some of these were included, one that mentioned that this stimulating and non-judgmental atmosphere emphasizing physical and emotional safety. And if you've ever taken part in any kind of recreational thing, typically the ones that I've enjoyed the most and been involved with, and you see this more often, is like this. This is non-judgmental kind of atmosphere where we're out there. We're out there working. Let's say I used to I liked hike and backpack and do trail maintenance, and that was my recreation. And, being involved with other people that do it, it's like a supportive kind of environment. We develop friendships, we develop social connections with those people, we develop shared experiences by taking part in doing those things. So, and that includes things like this camaraderie, being part of a group. And if we have, and I think we talked about the digital world and the challenges around it. It's very easy to stay inside, stay home, and not interact with people in a real setting. And I think that is a huge contributor to our mental health crisis because then we don't know how to go out and interact with people in a real world setting at times. Some other successes I noted is choice, and so flexibility with that, the social component, um, having others around us when you're doing the activity. Also looking at communication and also building practical skills. Some other benefits, again, related to recreation and mental health. They've noted in studies, this study looked at rehabilitation of clients with mental health disorders and in reviewing, and they noted that people who take part in organized recreational activities have better mental health, are more alert, and are more resilient when against stress of life. So again, resiliency, because if we are doing some things to help our physical and mental health when these major life events happen, it doesn't mean that they're not going to happen. It doesn't mean that we have a challenge to deal with them, but we have ability to kind of have a different perspective, to step back and we have some resiliency. We have some social support networks to help us through those difficult, challenging times. They also know that recreation helps with increasing self-confidence, life satisfaction, overall morale of those individuals. And a couple other things in this particular article, the increase in cognitive ability. Again, because we're out there doing something, our body's moving, we're talking, we're learning, we're socializing, our brain is working. Our brain is doing what it's supposed to do. And so it helps build our cognitive ability. It improves communication. We learn how to interact with people, even if it's a sport and let's say we lose or let's say there's a rule violation. How do we handle that? And being able to communicate with that or deal with our frustrations in positive ways are all things we can do through this kind of recreational participation. And so from patient viewpoints, they noted things like the socialization, uh, more information, and being meaningfully engaged are really important to overall recreation participation and also our mental health. Now, there's a couple studies out there that looked at recreation in college students. And so it's important to think about that too, because we work at the university, we interact with a lot of college students, but they noted that recreation has, in this study with Litweiler, talked about post-secondary students, but it helps with maintaining positive mental health by being involved in some kind of recreational pursuit. Um, They noted that activities or recreation that include things like mindfulness and meditation, yoga, um, can help reduce perceived stress, anxiety, and depression and negative moods. Um, a colleague of mine at University of Florida is doing a program and done some research related to garden programs and students and their resiliency and academics and overall mental health benefits. The another study by De Jong looked at again recreation college students. They found that physical recreation, in particular, by taking part in that, helped these students take to meet the physical activity guidelines that that we have research showing supporting taking part in physical activity at a certain level for a certain amount of time helps improve overall health outcomes. Also noted the social support and lower levels of psychological distress and obviously loneliness. Again, the social component is such a critical piece to overall mental health. And a couple more articles related to research and recreation. And this is a concept, this is really talking about recreational therapy in general. And I'll talk more about what recreational therapy is and what how that can help us. Um, but this looked at community-based recreational therapy programs. And they found that those that took part in these groups, that swimming and nature, social clubs, showed improvement in self-esteem and mood for those who have had a mental health diagnosis. Um, it also noted the importance of recovery being is an individualized thing, individualized process. Through recreation, they're able to help build the recovery, also help improve, develop hopefulness, and increase positive identity. And they talked about some things in this related to the experience, included the development of connectedness to others, hope, our better understanding of our own identity and meaning, and empowering us. So, another article, and this is the final main one related to community-based recreational therapy, is the idea that, um, again, our poor well-being impacts our mental health. It's interconnected. But in recreation programs, again, the social interaction helps improve overall well-being. And this is another really important thing that I do want to mention. They also talk about this, and this is for people who had schizophrenia disorder, spectrum disorder, but medication. So do not leave today and think, okay, Dr. Stowell said recreation will help with my mental health. I don't need to go see my psychiatrist anymore. I can stop taking my medication. Absolutely not saying that. Recreation is a piece of a holistic treatment and holistic um, system that we can put around us to help us. Medication for some is still needed, and following your doctor's guidelines of what medication you're taking and why is important. But showing that recreation can be an added component to help with improving your overall outcomes and helping maintain and manage your mental health. So it's important to think of pharmacological health and recreation and how that can interact and help you with your overall mental health. I want to take just a couple minutes now because I talked about recreational therapy and that's what I teach at the university. I want to talk about what that is and how that relates to mental health, and also talk about what that may look like for someone that it does have a mental health challenge or is getting treatment for mental health disorder. So recreational therapy, this is from the American Therapeutic Recreation Association, but it's a systematic process that utilizes recreation and other activity interventions to address needs of individuals with illness, disabling conditions, or adverse circumstances to help promote psychological and physical health, recovery, and well-being. And with that, the idea is to restore, remediate, and rehabilitate. Um, and recreational therapists work in a variety of different settings, in both in the community and in clinical settings. They help individuals overcome barriers to their well-being, and participate in meaningful leisure activities. And so what that looks like kind of from a perspective here, and this is a model that we use a lot, talk about a lot in our profession is this leisure ability model. And we'll kind of zoom in on it in just a moment. But this is the concept of if somebody has an illness or has a mental health challenge, we have this sort of continuum. And so we have like this crisis come up. And so we have to go into a facility to deal with that crisis, or we have a physical health issue, we have a heart attack, we have some other thing. We're kind of in that beginning stages right here on the far left here, the bottom corner. It's just improvement, functional improvement, helping deal with, life support, helping deal with beginning treatment, helping deal with rehabilitation. As you go through that treatment process, you move up along the line where we've stabilized. We're in a physical place that is better than we were when we came in. And as a recreational therapist, we start looking at leisure education. We start helping people figure out, okay, what is your leisure? What is your recreation lifestyle like? Do you do anything? Do you just go home and sit on the couch? And then we help give them ideas of how to adapt activities they've done in the past, or ideas of new activities and new recreational opportunities they might want to try. And then ultimately we move them along where at the end here, they're participating fully in recreation once they get discharged. And they use that as a tool to help maintain their health and wellness once they get through whatever recovery process they're going through. And with that, um, we take again from the left, the beginning, there's this treatment all the way to this leisure ability and skills to where we can go out, we're independent, we're able to make decisions on our own to say, hey, I know there's this recreational program I like, I want to go sign up for it, I want to go take part in that. And again, when we're talking about the value of recreation, the social components, the physical components, knowing that, okay, how do I access these things? How do I get to them? How do I find out about them? What am I really interested in? What do I want to invest my time and money into? This is part of what we do as recreational therapists is help people learn those skills. So then once they're finished working with us, they can go out and be active in their community. Another model that's used a lot in our profession is this health protection promotion model. This is from Austin. And so again, it's a kind of a continuum kind of look at this of like saying, when we are at the beginning of our treatment, we have the recreational therapist and other therapist treatment team is working together. There's a lot less choice as we go through our recovery process. We begin learning more skills. Begin taking more direction. We begin taking more autonomy of making choices and being involved in some kind of recreation to help maintain, and improve our overall health and including our mental health. And so recreational therapy, we use assessment, we use treatment processes, we use planning to help people get to the point where they can go out and do recreation, take part in recreation on their own without us having to do the intervention for them. And so that helps ultimately in a lot of things like prevention. It helps maintenance, and also helps improve skills over time. So before I wrap up, I did want to talk a little bit about our program in particularly. Um, and so I work in the Kinesiology Recreation and Sports Studies program. I teach recreational therapy. I help I'm the course instructor for our field experiences. And so recreational therapy is a profession. It's a job. It's the best job in the world, in my opinion. And there are a lot of places that people work. In Knoxville, we have several rec therapists out there working in different skilled nursing facilities. Several of our behavioral health programs have recreational therapists on staff. We have and so there and around the country, there are jobs at behavioral health hospitals. There are community jobs. The city of Knoxville has a dynamic recreation program where they have different adaptive sports. So there are some opportunities out there to interact with recreational therapists and be involved in some cool programs that we have in the community and in the Knoxville area. So we do have a bachelor's degree program. So students that come to our program will be qualified after they complete it to sit for the national exam to become a certified therapeutic recreation specialist. Don't ask me why the name is the name. They came up with that years ago. But so that is the national certification credential for recreational therapists. In some states, they have licensure. So that's a licensed recreational therapist, which is on top of that. Tennessee does not have that right now. North Carolina does. But so if we're practicing as a recreational therapist, you will be a certified therapeutic recreation specialist. And so that's what we train our students to do. We do that through a lot of experiential programming and courses. One of those programs is called Therapeutic Recreation in Public Schools. So we have students learn about recreational therapy. They learn how to plan. They learn how to assess students that are in the special education programs in our schools in the area. They plan them. They go out and they interact with those classes to different high schools, to elementary, middle schools, and they run programs. And so it's a hands-on application of what we're teaching in the classroom setting. We have adaptive sports. In At UT, we have Vols Adapt program. So we have days where our students on campus can learn about different adaptive sports and come practice and experience those. We also have a program called Big Orange Field Day that's offered in the spring where we do sports and our students are involved in helping plan these things. And so again, we really pride ourselves in being very experiential in the work that we do in our program. We do field experiences and spiritual education. One of the big things we do is Camp Quaternia. So this program, this is our 50th anniversary. We work with students, our kids with disabilities, and we run a camp program for them. And in the spring of every year, we have a course called, it's RSM 326. Any student on campus, any college student can sign up to take that course. We learn how to plan and we plan out the camp. And then in April, the students go for a week and they are the camp counselors and camp staff of that program. And so they get paired up one-on-one with a camper who has a disability, and then they go through the week-long program that they run. And this has been a hugely impactful program over the course of the years. We've worked with thousands of college students, thousands of kids. Many of our students, once they graduate or finish our program, particularly this class, say it's one of the most meaningful experiences they've had here at the university. And so it's a great program. We have another camp in the fall for adults with disabilities, 21 and older, called Quaternia Retreat. And then we have this thing called the Tree Team. So this is Therapeutic Recreation Experiential Education. They kind of are graduate assistants and assistants that help plan and manage the recreation therapy programs that we offer through the university. So that's kind of what we do here on campus. If you're interested in that, you're like, hey, I've never thought about that as a career, reach out to me. I'll share my email after this. We can talk and talk about what that looks like. But I do want to finish up and want to give some time for questions also. Gave you a lot of information real quick about recreation and the mental health benefits. And where does that leave us? And so one of the things I know I want to state is recreation is an important part of our prevention and intervention. So it helps preventing health issues, mental health issues by being active and having an active lifestyle and recreation. It doesn't have to be a sport. It can be art. It can be any other kind of recreational thing. And also it is an important part of interventions for somebody that does have a mental health diagnosis and receiving treatment. As you think about this and kind of process this information, I want you to also start thinking about how do we help others? And that's us observing and watching and who's out there, what's going on. Colleagues, our family and our friends. What are some things we can do? Inviting them to things. If we are interested in a specific recreational pursuit, invite friends to be part of that. And then finally, when we do need to get to the point where we have the situation where we need to seek out our own professional help, um, you see if the program you're at has a CTRS on staff. See if you can be involved in the recreational therapy interventions. And again, multiple behavioral health organizations around this country have a CTRS on staff. In fact, from last I looked, it's one of the highest employers that we have for rec therapists is at behavioral health hospitals, behavioral health settings. And so what now? And so one of the things that's important to think about when we think about mental health, our own mental health, is I think we need to think about, yes, there are recommendations, right? There's activity recommendations by the CDC of how much we're supposed to do. But let's think about somebody that has a mental health crisis, has a mental health challenge, or just has ongoing mental health issues, right? Many times when we do that, it can become very overwhelming to begin to think about, okay, here's what I'm supposed to do. I have to do this, 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 this. So what I want to encourage people is to think about what can you do now? Okay, maybe you can't spend an hour jogging on the green belt. Can you spend 10 minutes doing something? and start where you're at. If it's 10 minutes, if you don't have the physical ability to do something more than 10 minutes, start there and build from that. Research shows that things like gardening, moderate physical activity daily, just simply walking for 30 minutes has an impact on our mood and improve our mood, helps reduce stress levels. And so can we start off at small levels? As time goes on, as you become more active, and become more involved with recreational programming, you're going to be able to do more. You're going to feel better as you're seeking out counseling if you need that, or medication treatment or anything. You're going to make progress and you're going to feel better. And one of the things is the more you do something, when I take part in recreation, the better I feel after I'm done with it. And you'll start experiencing that, and you'll start wanting to do that more, and it'll help build those kinds of um, um, motivation to keep going. The other thing I want to state is, and I want to just be very clear, is, seek out professional help when you need it. There's nothing wrong with seeking help and asking for help. The challenge that I have for everybody, whether you have had mental health challenges in the past or you never have, I want you now to think about before it becomes a problem or a crisis, know how to access your employee assistance programs, know how to access your insurance and your behavioral health insurance. Because when you have a crisis, if you don't know how to access that, you're going to have a hard time. And it's going to be hard to do that because there's a lot of barriers. We talked about access and time. We talked about trying to find a counselor, connect with a counselor that fits well with you and who you are. You might go through several counselors. So just explore that. Take some time to understand that. Also take some time to know that. So then if others around you are experiencing crisis, how do you help them find those resources they need in their moment of crisis? So that's kind of it for what I want to talk about. I don't know if there's any time for questions or if anybody has any questions, but I do want to thank you all. And I think the most important thing is if you don't take part in recreation, think about what you want to do and make some decisions and move forward with some kind of recreation at some level, and it's going to have a benefit for you.
Thank you so much, Dr. Stowell. That was great. And you're getting lots of claps in the Zoom. We really appreciate you coming to talk to us. And I love this idea that you shared of like recreation as restoration, but also remediation and rehabilitation. So this idea that it can be all these different levels of mental and physical support for
Yeah.
people. So that's really great. Does anyone in the Zoom have questions? I don't see any in the chat, but feel free to put them in there if you have one.
And if not, and you don't feel like asking a question, send me an email. I'll answer.
I have a quick question while other people might be thinking of theirs. Um, this idea of like recreation as prescription, like do you find yourself like working with people and needing to like almost prescribe it, like instead of just suggesting that they do it or recommended 2.5 hours or whatever, like do you find yourself needing to say like I'm prescribing you like 10 minutes of a 10-minute walk every day or something like that?
Yeah, that's a good point. And I didn't bring that up, but social prescribing, which is kind of a new topic or newer topic. I can't prescribe because I'm not a medical doctor, but there are medical doctors that are starting to do this. And there's a Nature Network that does social prescribing. There's been some research showing even like a doctor prescribing to their client to go to a museum, and there's benefits to that, that connects to recreation. And I think yes, I think sometimes again, if particularly if we're in a mental health situation, if we have depression or anxiety or some other diagnosed condition, many times it's like we kind of get stuck within ourselves, and we have a hard time thinking beyond kind of what's going on right now. And so having somebody say, "Hey, you need to go come together, come back with a list of different recreation programs within your 10-minute radius of your community," giving them tasks to do, because then it helps break things down into smaller elements, instead of thinking about this big step. Like, okay, go plan a week-long vacation, right? That's extremely anxiety producing. But if we can start breaking things down and prescribing and telling them, hey, this is what you should try to do, it's a way to help us kind of make small steps forward, um, and make progress with that.
Yeah, that's really helpful. Thank you. And I also like this idea that you shared at the very end, which was like navigate your resources ahead of a crisis, like
Yeah.
navigate your resources now so that you know what to do. Um, there it looks like there is a question in the chat. One of my questions would be if you could have a magic wand, what changes could take place to make recreation and recreational therapy more accessible?
Oh, that's a great question. I think one is funding, and that is a big issue. So there it's expensive. I've got four kids that do sports, and it's not cheap. So I think finding ways to fund it is important. Recreational therapy does receive some funding in some states around the country. We have Medicaid waivers that support that. So and you'll see. States that have more rec therapists have Medicaid waivers because they're helping support that. I think the challenge in our profession is that research. We always hear research, 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 but really having more research, better quantifying the impact it can have. Because if we can do something, if we look at a holistic approach of mental health, there's counselors and there's psychiatrists and there's treatment and rehab, but what are we doing outside of that and interacting in a better way and having a better system put together, I think would make and show the case of this is actually going to save us millions of dollars if we can help manage people and help people before they get to a crisis and also help people deal with something while they're in crisis until they can get the treatment they need is important. So I think funding is going to be probably, in my opinion, one of the biggest keys of making that work, and supporting people that don't have the financial means to do that. And that becomes a limiting factor of a lot of what we do.
Yeah, that's a good question. Um, and Haley also said, I learned so much about recreational therapy today. So
Yes.
thanks.
And I think awareness is important. And so people don't realize this is a thing. We have about 16 to 18,000 recreational therapists in the United States. So it is a thing. It's a viable profession. But if we don't know it exists, we aren't going to ask for it. Just interestingly enough, the Individuals with Disabilities Education Act for um, elementary K through 12 schools, you can request recreational therapy as part of your IEP for your children. They don't have it always funded, but people can ask for it. And so those are things that people don't realize even exist. And often we think we don't need recreation because it's not that critical thing, but we need to also know it's important. And so we need to raise awareness about that.
That's great. Thank you. Any other questions from the audience here? Got a few more minutes. All right. I'm not seeing any come up. Dr. Stowell, thank you so much.